Why Botox Cosmetic? Botox is a safe injectable liquid formulated to treat what are known as dynamic wrinkles. These types of folds and wrinkles are those that are formed from underlying muscle contractions. This fact makes dynamic wrinkles a great target for Botox injections. The Botox product is developed using a special type of bacterium called Clostridium botulinum. This bacteria works only on muscles in the area that it is injected into. Is Botox safe? Botox is completely safe, having been used to treat millions of patients for the past 2 decades. It has been studied extensively and is carefully made under only the most strict of controlled conditions in a laboratory by allergen. After injection, Botox goes to work to temporarily paralyze facial muscles, causing dynamic wrinkles. It does not travel systemically throughout your body, but remains where it is injected to do its job. Of course, over time, the injected Botox will be broken down by your body and the effects will fade. At this time, most patients choose to have follow-up injections so that their results are maintained. How does Botox work? Dr. Anton injects you with the Botox liquid in areas that have dynamic wrinkles. Once the product settles in, it begins to impede the nerve impulses sent from the brain to the underlying muscle. This gives a relaxed appearance to the face and dramatically reduces the appearance of dynamic wrinkles. What does Botox treat? Botox is most commonly used to treat eye wrinkles, commonly known as crow's feet, frown lines, horizontal forehead lines, nasal squint or scrunch lines, lines on the neck. Medically, Botox is also used to treat a couple of other conditions unrelated to aging: migraine headaches and hyperhidrosis. Botox helps to prevent migraine headaches and lessen their severity. Hyperhidrosis is a condition involving excessive sweating that Botox is very helpful in treating. How long before I notice results? Some patients begin noticing their Botox results within about 3 days, while others may take as long as 1 week to achieve optimal results. Dr. Anton may ask you to return following your first treatment so that he can examine you and assess your results. Certain patients only receive a partial response from their first treatments with Botox. It may take 2 or 3 treatments to achieve complete relaxation for some individuals. Would I make a good candidate for Botox treatment? The best candidates for Botox treatment are adults with thin mouth wrinkles that become more prominent whenever they make certain facial expressions. Whenever you frown, folds and wrinkles can also develop on your forehead. Your facial muscles will be contracting, which pulls skin in a certain direction while skin and other areas becomes more relaxed. These types of lines and wrinkles typically develop around the eyes, around the lips, and the forehead center. Is there anyone who should not receive Botox treatment? For the great majority of people, Botox is a safe and effective treatment. But there are always risks with any type of procedure, albeit very small in the case of Botox. Pregnant women, nursing mothers, or individuals with certain neuromuscular diseases should not receive Botox injections. Anyone who is allergic to human albumin should also avoid treatment with Botox. The reason why it is not advised that women who are pregnant or nursing receive Botox is because it has not been tested in those particular situations. How long will my results last? Patients normally experience results lasting anywhere from 3 to 6 months. Patients typically return 3 or 4 times during their first year of treatment with Botox. After that, it is more typical for them to return 2 or 3 times annually as treatment becomes easier. When facial muscles have been relaxed for a long period, less is needed for the maintenance of that relaxation. However, each patient is unique and will not always respond the same as other patients. Some patients who regularly receive Botox injections have a feel for when the product begins wearing off, and facial muscle movement is returning. They choose to have follow-up injections slightly before this occurs, so that their results are continually maintained. Can you become resistant to the effects of Botox? While not impossible, this is extremely rare. There is a possibility that someone who was internally poisoned by botulinum as a child may have developed antibodies and become resistant to Botox. Why choose Dr. Anton at HD Esthetique? Dr. Anton is a highly skilled and renowned cosmetic surgeon who has treated many patients with Botox over the years. Dr. Anton is highly trained to take into account multiple factors when treating you with Botox. He tailors your treatment to your unique face, with considerations such as your most used facial muscles, facial balance, and the results that you wish to achieve. Botox is a safe and effective injectable treatment that helps to eliminate facial folds and wrinkles. It is a minimally invasive treatment that requires no downtime whatsoever. Are you bothered by the appearance of forehead lines, lines around your mouth, or other areas of your face? If so, we invite you to contact the office of Dr. Anton at HD Esthetique at 305-668-2853. Visit hdsesthetique.com.